You're live. All right, good morning. It is May 8th, and this is the Senate Health and Welfare Committee. We are looking at H 938, and our goal here is to have some final markup for the bill. And then I'm thinking that we'll look at the final draft early in the week, next week, and vote on it. And that includes the language as well as the money. And then we'll be voting on it, either come in at 9 o'clock on Tuesday or 9 o'clock on Wednesday. So we'll be doing that. We won't be making changes when we vote. It's just going to be going through and voting. So that's next week. So today, let's look at the draft that Katie has for us. Okay. And there are lots of things in here, I think, based on the testimony that we heard yesterday. And others that we've had, I've heard things like we need flexibility in the system. We need to make sure that people have the access they need. And then Rep. Wood also gave her vision for Senate was why the bill was written and drafted as it was. So just keep those things in mind, I think. Go ahead.
Okay, good morning.
Would anyone mind moving the page? Because I get rid of it.
I'm going to.
It's just that I couldn't see Katie. All right, and this is on our webpage.
I think so. I sent it to us this morning. Katie McDonough, Legislative Council. We have draft 3.1. We jumped right over looking at 2.1 yesterday. So the changes from 2.1 and 3.1 are all highlighted in blue. And so that is what we're looking at today. We'll cover the changes that we didn't look at yesterday.
Okay, good.
So I think we can scroll quite far before we have any.
Let's look at the changes and then we'll go back through the whole.
Okay.
Yeah.
Okay. Where are we? Okay, we're in 2202. This is the establishment of the continuum, and there's a new subsection D that all funding opportunities available under the program shall be open to any entity or community partner, including those that did not previously receive funding.
Okay.
Okay. Okay. For permanent supportive housing, instead of OEO and its community partners, changing this lead in to the Agency of Human Services departments or their community partners. And then pulling language that had been in when permanent supportive housing was in levels, there was language that didn't get moved down to this section. So this is pulling language that had been in the bill when permanent supportive housing was level 4, and now it's in this new section of the bill on permanent supportive housing.
So it's really technically looking at
well, it got dropped.
yeah.
So permanent supportive housing services may be utilized by an eligible household for as long as the eligible household's plan indicates it is necessary.
Okay.
I missed one. Oh, this was the in lieu of. Remember, we had like the to be in lieu of, and it felt awkward. So this is take 2 or 3. Emergency housing provided through the program is not intended to take the place of any other AHS time limited permanent housing.
That's good.
Okay. This is our section on notice, appeals, right to a fair hearing. And there, if you remember, we took 3 subsections out of the last time we looked at it. And this is adding a new subsection in that says fair hearings held pursuant to this section shall be conducted in accordance with 3 VSA 3090 and 3091, which is the Human Services Board language. I'm not sure if it's necessary. It feels to me a little duplicative of, they may file a request for a fair hearing with the Human Services Board pursuant to 3 VSA 3091. I think it's already clear that the Human Services Board processes are being filled, but this is definitely belts and suspenders. It pulls in 3090 and it makes clear that all aspects of the hearing are in accordance with those two sections.
I want to stop here for a minute because I know I received some information, so that would make the first part a concern. So Brendan, I'm looking at you.
Yeah.
Do you have that?
Yes, thank you, Brendan Atwood, the Agency of Human Services. So our concern with the notification section is really about the 30-day notification. In many cases, in fact, over half the participants are not allotted a time period more than 30 days. So it'd be infeasible for us to meet that requirement. We feel that the notification processes in place already are sufficient. We give, upon application, notice of the duration for the stay, information on how folks can appeal, all of that. And so we think that that's unnecessary, but our biggest concern is really that it's not feasible to provide that notice 30 days in advance.
We've discussed that before, haven't we, too?
I think we have, yeah.
Yeah, we brought it up. I don't think we've ever really fully discussed this, but so that would be on what page? On this line?
This is page 25, line 10. So you have language that the office or community partners provide written notice when the applicant or participant is denied, reduced, suspended, or terminated from services. Notice shall include first, the actual legal basis of the decision. Second, that's what is being referred to. The effective date of the action, which in the case of termination, reduction, or suspension, shall not be earlier than 30 days after the date of the notice. And the household's preferred method of communication, which was also raised.
So the issue with the 30 days, Brendan, is
Individuals may not even have a stay that exceeds 30 days. So giving them a 30-day notice if they're, only have, say, 7 days or 14 days is not possible. So we think that the existing notification process works.
what about just saying adequate notice?
I think that's great.
And I see your hand is up. I'm gonna go with adequate notice.
I have another idea.
What is your idea?
Thank you. Brenda Siegel and Homelessness Vermont. What if it said 30 days or if less than 30 days, the period of time applicable under their current voucher?
How do we measure all of that? Does that work?
What's that?
Cuddle. What are your thoughts?
I think that adequate is more workable for us. And noting that we're going to go through rulemaking, we're going to be back before several committees. If that notification is not up to the par, we'll have opportunities to
I'm
address
kind
that.
of feeling that way as well at this point. So we could do that. I know there's disagreement about that, but let's go with that.
Madam Chair, if I may, there's just one other comment about the allowing for the notice to be given at the household's preferred manner of communication. We're limited in what types of communication we can provide, written communication, emails. We can't be doing text messages or many other potential requested modes of communication. So we would request that be modified as well.
How would we do that?
We could say in writing, telephonically. I mean, I think we can limit the options from which an individual can choose based on what we can do, but
You can't deliver it in person. if you
Right.
don't know where they are.
first class mail, text
And
messages, those are
understood.
not going to be options for us.
Yeah,
I can wordsmith it later.
that would be. Good.
So preferred method of communication, from among the following options.
Sure.
Okay. So what are the options? It's telephone, email.
We can, do you know offhand? If not, we can follow up.
Yeah, mail, electronic.
Yeah.
No, sure.
Now,
The fair hearings, why do we have the word fair in there?
Oh, that's in the statutory language.
is?
That's a whole
Hearings.
fair.
I just don't have a problem.
Fair.
I just was surprised it said that.
Did you say you didn't want to be fair?
I love being fair. Also like to just have a hearing. Just imply.
Madam Chair,
Yeah,
Nellie Marble, Senior Advisor to Commissioner, Department for Children and Families. The department's preference would be either email or US mail. Our current,
but I mean, so.
our current practice is we email them their notice of eligibility. And then failing that, they can
US,
they can go pick it up at a local district office. And then as a method of last resort, if we have a mailing address on file for them, we can
okay.
mail it to them. That's our
I'm
current
gonna leave it
practice.
in capable hands, for Katie to wordsmith this, because I think she gets it. And we'll,
Okay, but I had heard one person say telephone and somebody else say not telephone, so now I'm not clear.
I think telephone is an appropriate
Telephone is
option,
appropriate.
and so, and if it works, it works. Yes, ma'am.
Deanna Hartog from Legal Aid. We would say that the notice has to be in writing, either in an email or in physical writing, in order to comply with due process.
So that's why people don't want telephone.
Telephone is
Some
not.
physical.
Yeah.
Okay.
It needs to be written.
That makes sense.
Okay.
Okay.
Brenda Siegel and Homelessness Vermont. The only thing that I would add is that if people can't read or write, which 10% of the people we researched couldn't, there has to be some method for explaining that to them.
Well, that'll come out in the rules.
Okay,
And, we can't micromanage everything in here. But I know that there are other places in this building that do micromanage, and we're not one of them.
I know.
You got it?
Got it.
Thank you. Okay, so that's good. I'm glad we stopped at that little place. That's all.
Okay. Let's keep moving. We did that.
We got a fair hearing.
Yeah.
What page are you
27.
27. Now we're in our rulemaking section, and last time we met, you wanted to add a process for reinstatement of services after a household's termination from the program as one of the items on rulemaking. So that has been added.
Yes,
Madam Chair, if it's appropriate, I think our concerns on this section just relate to the timeline, so we can address that now or at a later time.
okay.
But
Oh, I know the dates.
Yeah.
That's,
We hold on that until we get to
Yeah,
the
later.
rulemaking section, because this is just the contents of the
Yeah.
rules. Sorry, thank you.
Thank you.
Um. Which might be the next thing we do. It is. Okay, here we go. So since we've last looked at it, there was a concern about the emergency rules being due July 1 of 26. So now this language has them due August 15th of 2026. And then there is this new subdivision A2. This is between July 1 and August 14th. DCF is to administer the continuum by applying the General Assistance Emergency Housing Rules approved by LCAR on March 13th for the administration of this act, meaning what the rules that are currently, the program is currently operating under.
yeah, it's important to have some rules.
And then subdivision, there's a 1 added because we're adding a 2. That prior to filing the permanent rule with the Secretary of State, I think that should be 838A2. Let me double check that. The department shall work in collaboration with stakeholders to develop the rule, including holding at least 5 regional stakeholder hearings throughout the state. And by January 1, submit draft rules to the 2 policy committees for review and consideration of committee comments. That's it.
Did we say January 1?
January 1 is when draft rules would be submitted for
Okay,
comment.
I don't.
Okay.
Okay,
My turn.
okay,
Brendan Atwood with AHS. So we appreciate these amendments and, you know, in particular, the stakeholder engagement is something that we think is important and we're happy to oblige doing all of that before January while still having to do first an e-rule and draft what's going to be a pretty substantial rule is going to be very difficult to meet that time frame. So we'd like to extend the time we have to do that draft, but still meet the ultimate deadline for the permanent rule that's in the bill right now. So hoping for some flexibility there.
what do you want it to be?
So what we proposed is the e-rule by October 1st, which would just give us enough time. The e-rule is going to be a substantial rulemaking itself.
So the August 15th was a date I picked, because we really want this to move along. But we'll keep going and we'll talk about it.
So August seems ambitious. I think maybe September is achievable for us.
Okay,
October.
we'll negotiate September. Do I?
On October.
The 15th?
I know. So let's make it September 10th. The reason I say that is September 1st is difficult.
Yeah, no, that's great. And then I think
I
the draft being completed, what we would propose is by July of 2027.
Oh,
Again, to allow that stakeholder engagement time and still have several months for the committees of jurisdiction and others to comment on this before we move.
oh, instead of January,
Correct.
which date? So you're changing January 1st to submit a draft rules. So what?
Yeah, so
the point-
e-rule in September, draft rules in July of 27, final rules by October of 27, consistent with what's in the bill now.
So what you're skipping over is allowing for this committee and the House Human Services a review of the rules. So is there a date earlier
Yes, I think so.
that we could put in there? January, I understand, it's
May.
problematic.
Would that be a little bit?
March, April.
April? I'm getting this down.
Yeah, I think one of those would be good.
I think if we could, obviously, later is better to allow for the necessary stakeholder outreach. I think April 15th seems like a reasonable middle ground. That sounds right.
First, I have no idea what day of the week these things are, so maybe we're gonna have to check.
Well, and we'll get it to you before those dates, if it's on a weekend.
Town meeting.
What did we say?
March 15th.
Oh, you were in March, they were in April.
If you're in April,
We're in April,
April 1st?
April 1st. Let's go with it. April Fool's Day. How ambitious.
Again, we don't know what day of the week it's in. It could be Sunday.
And we'll get it ahead of time on for sure.
That timing might work well because you're through crossover, but before
Yeah,
the
you're
crux
right.
of the end of the
This
session.
is a good point.
So you might have a lull with which to do this.
We are definitely like a slow down process, right?
Okay.
Depends on who's sitting here.
So like keep moving? Are we good with the rule?
Yes, we are.
Okay. Okay, so now we are in the section on the Vermont Rental Assistance Bridge Program. There had been a sentence in subsection D about individualized plans, and the sentence from the House version is being added here, restored here, that program priority shall be given to recipients of the home program as established pursuant to Title 10 who have not reached 24 months of rental assistance.
Go ahead.
For the record, Susan Aronoff from the Vermont Developmental Disabilities Council. This committee was one of the committees that received the road home report. I submitted comments that gives you a hot link to the road home report. The road home report was required by the legislature last year to answer the key question of how are we going to develop housing for 600 adults with developmental disabilities who currently 40% are living in adult foster care, very unstable. 40% are living with family caregivers, many of whom are aging. The legislature has
I
identified.
get it. So
Okay,
we're
so-
asking
So one of the
here
recommend,
is,
our ask is 3 words. Right now, the rental assistance would be limited to only people who are unhoused. And we understand that that is this target of this bill. However, our folks think people in wheelchairs who need.
we don't want to exclude these folks.
Yes, so
Yeah,
and we
understood.
don't want to exclude people in corrections, so this is supposed to serve everyone in AHS, so we just want to add. To the last line of C, where the priority is people exiting homelessness, we just want to add comma institutionalized. That would be folks in nursing homes, people in corrections, or
At
risk group at risk of institutionalization. And I would just say, Agency of Human Services is already serving these people, and in order to move them into housing, they need rental assistance.
got it.
Thank you.
Does that fit here? Kate?
So I think you might be referring to an earlier version of the draft, with I saw your memo and it didn't fit in where
It fits in
median
If
sufficient
it's
the
on
last
page 36 lines 2 through 5, that's I think.
appropriate length of assistance under this section and institutionalization. I think maybe one.
Oh,
Yeah, the one, the
It's a
very
very
last
close
line of the AHS
Oh,
edition.
It's here in one.
And
Designated.
the program shall be accessible.
Sorry, go ahead.
I think maybe we're
So
looking at
this
E1.
line. Yes.
So this is an older draft. This, 3.1. Yeah, where are you? C one. I think you want E1.
Well, perhaps, that's where the fund would come from, but the very last line is where it says the priority shall be.
Okay.
And that controls every,
that's on page 36.
that very, you were right there, that very last line. With priority given to those exiting homelessness, comma, what, you were right there?
Are you saying E?
Yes,
E, okay.
Yes.
E,
Sorry, yes, I know.
homelessness, comma, institutionalized or at risk of institutionalization.
Okay, thank you.
Thank you.
Is that what the committee wants to?
Uh-oh. Lily, go ahead, please.
Yeah, we really appreciate Susan's comments, and I think people did work really hard on that really robust report. I think what's we're running into is 2 things that had very different intentions and goals. And I think that we put forward a very clear proposal with the governor's recommended budget to address homelessness and to kind of grow what AHS was providing in terms of rental assistance for people experiencing homelessness. The House proposal included this broader scope, which to us feels like, I think, premature to have under the same umbrella at this time.
So,
And I
and
think-
yeah, I hear what you're saying,
Yeah.
and I had thought about that. So we're not trying, what we're not saying that the continuum program is responsible for folks who are institutionalized or at risk of institutionalization. What we're saying is that the home program is not only for those who are homeless. I don't know how to say that right here in this, because if you read this, it says that the home program is only for this cohort. So,
Because I think that for the rental assistance, I mean, that is the budget that we have where we have, we're leveraging Vermont rental subsidy, which is a subsidy for families on reach up experiencing homelessness. And then rental vouchers to help support those really in supportive housing to make sure we can actually have a supportive housing model of the services and the housing. I think what we've proposed, because like our colleagues at DMH have some support services for people exiting institutions, is that I think we're very committed to working with Vermont State Housing Authority to see how to develop in this area. I think we're not yet sure that this is the bill to address populations other than those who are exiting homelessness, and that it might be more appropriate to do the study and then have that addressed
Understood.
separately.
I understand exactly what we're saying
Okay,
here, that what you're saying, and I agree with you. The issue is by putting this specific language in, we are excluding others within that discussion and program. So there has to be a way of saying that folks who haven't used their 24 months of parental assistance will have priority, and somehow that this isn't the entire program, that there are others who will be served by the program. I don't want to say that. So the program shall be accessible to eligible households served by each of the agency departments, we know that. Exiting homelessness.
I wonder if
It will not be to the exclusion of,
well,
of other, groups eligible groups. Somehow we have to say that. And I know I understand what you're saying, but
because I think leaving it as is puts a financial pressure to expand without funding that has been allocated for that
we're not
expansion.
taking any
So-
funding away from what's appropriated in the bill.
But you're expanding who would be eligible for that.
We are
rental.
not expanding who's eligible within the bill. What we are saying is people who are outside of the bill will not be excluded from the programs. That's what we're saying.
Madam Chair, so part of what we're looking for is frankly the time to do our due diligence to understand what this program would look like, what the impacts would be across the
Absolutely.
agency. And so maybe if we had some language that included or other individuals, other populations as identified by the agency and the state housing authority, what we're really contemplating here is a process over the next year to build what this program looks like. And so I think having that flexibility makes sense, but making sure that in FY27, these funds are used for these folks who are exiting homelessness until we've had the ability to do that due diligence and broaden the scope, we think makes
So
sense.
but that's exactly what you're saying. You're saying you're giving priority to folks who are homeless, where there are other folks who've been working on this for a long time who shouldn't be excluded.
Right, and just to be clear, just for FY27, what we're contemplating here is a process to expand this, and then going forward, the program would look, well, it would be more expansive following this work, which would not be ready for
We're
FY27.
gonna have to disagree on this.
Fair enough. But if we had language that allowed for additional flexibility as determined by the agency and the state housing authority, I think that still allows you to serve these additional populations
Sure.
in a way that doesn't
We just want to make
put the
sure
cart
we're
before the
safe.
horse.
Right,
Yeah.
understood. I got it. Yeah, I think we're all on the same page, so figuring out how Katie's gonna say it. Not easy.
So there's been 3 proposals. I've written them all down. So you have being specific, institutionalization or at risk of incorporating in some way that we shall not exclude, shall not be to the exclusion, this priority group shall not be to the exclusion of other eligible populations, or something along the lines of other populations identified by AHS and the State Housing Authority. Did you have a preference of how to address this?
The second one.
Okay.
Amy, did you want to comment?
I was just gonna add that Amy Johnson, Vermont Care Partners, this language is important because this is an Olmsted issue.
Yeah, it
And
is.
so it needs to be in there for that
Yeah,
reason.
Act 248. Yeah, we got it. Okay. And that is part of the agency's, all the departments in the agency have folks who might benefit, so you want to make sure you're capturing the world. Okay.
We'll keep moving. Okay, so here are our expenditures. In subdivision 3 under housing and hotels and motels. This appropriation has been reduced by 500,000. And then you have a new item of $500,000 for the Community Resource Center. Which is coming from base GF funding. And then, should I wait on that?
Sure.
So these are the, what do you need?
I'm looking at that cord.
Oh,
Oh, she needs a plug in.
I got you.
Oh,
But it's not turned on.
Oh. Let's see. Oh,
Good.
that's, thank you.
That would be devastating.
That would be outstanding.
Should I move on from this one?
Yes, please.
Okay. Okay, and also in this expenditure section, there's a new subsection D that on or before October 1 of 26, January 1 of 27, and April 1 of 27, the office is to submit a written report to the appropriations and policy committees describing how funds referenced in A have been utilized to date, including whether expended funds were one-time or base GF, federal funds, or global commitment funds. I think that's it.
Okay.
We should look at.
All right,
Let's
so
see.
now we can go back to the beginning. After Lily.
Thank you
Go
so
ahead.
much. Yeah, and I'm not sure if I introduced myself, Lily Sojourner, Director of the Office of Economic Opportunity. So just on page 38.
Is it in any of the blue writing?
Yes, it's the two things in the blue writing.
Wait, page 38. I'm not-
So the first one, Katie, the 9 million. To make that reduction, I just wanted to note that that corresponds with a reduction in motels for about 17 households. And that number is not changed in the previous sections. And so just identifying that if this is the budget that you'd like to pursue,
Yeah,
that we would then like the reduction of the rate in order to comply
Understood.
with the budget.
okay.
So I believe that would be on page 16.
It's 16 of this bill.
Yeah.
I can go back. John, you got
This is the
he's a
1,000.
business guy.
Oh, the
Is the
700.
He's a
700.
budget guy.
Okay.
No.
It-
Good like leopards. though.
We're gonna go through. Yeah. Yeah. This helps Katie a lot. Thank you.
So yeah, so just if that's the budget, then that would need to be reduced by 17.
Okay. Okay.
It's the only one about this office. So the 700 rooms is calculated in that number when you did the math, or is like 17 rooms really affects? Like, why, so I'm trying to understand why you would go down to 673 or 683. Right, if you're at, up to 700.
Mhm.
Very specific. So what happens if you leave the 700 rooms, then you're saying that.
We're over by, we're
you're-
over that
So I'm
budget.
saying so when you calculated, my point is when you calculated that number, you assume 700 rooms. And 9 million, something.
The original.
The original number?
Yeah.
Yes.
Okay, that's all I'm trying to.
Okay.
Sorry. I wasn't articulating well.
No, I-
Finishing my tea.
I was like,
I think the lack of
Business
tape threw me off.
Office colleagues. I wasn't sure how complex your math question was gonna, but.
It was very. Sorry, thank you. I have to strike it from the record.
I did not hear any of that.
Just confirming.
Okay, so let's do this together. Now we're all in a row. Let's go back to page 1. And we'll go through the bill. And if there are significant places. I know I have one. And then we'll stop. I mean, we've been through it a couple times. We know that there are issues in here and everybody wants to make huge changes. But let's look at the things that are discrete. See what we can do. And that goes for the committee too. All right.
Okay, so you have
Otherwise, I think that's it.
a findings section. First, General Assembly finds that although an imperfect tool for measuring the true number of unhoused Vermonters,
That's getting, hang on a second.
sorry,
All I can hear is clapping.
I know, I
feel like I'm at a hospital.
I'll start over. The General Assembly finds that although an imperfect tool for measuring the true number of unhoused Vermonters, the Vermont Homeless Management Information System as of December 25 indicated that there were 4,022 individuals who are homeless in the state, 863 of whom are children under 18 years of age. And in 2024, Vermont Housing Needs Assessment notes that of the 36,000 primary homes needed in Vermont between 2025 and 29, the number needed to address homelessness is 3,295. And then we have our legislative intent section.
Okay, I'm gonna go ahead.
It is the intent of the General Assembly that unsheltered homelessness be eliminated and that homelessness in Vermont be rare, brief, and non-recurring. That Vermont reduce reliance on the inefficient use of hotel and motel rooms for emergency housing. That utilization of an emergency housing benefit to access hotels and motels through the general assistance program end and be replaced by a continuum of services. And a continuum of supports and services be available to provide stable pathway to permanent housing that meets the specific needs of households experiencing homelessness.
I'm wondering, based on, the testimony that we heard yesterday from the, organizations, the shelters and, the folks who are actually implementing this program, if we should say something about, this is for the committee to think about. If we should say something, number 5 about, allowing for, I'm worried about the flexibility piece so that there's some flexibility within the continuum that does 2 things. One, it facilitates the work of the organizations that are providing services and housing or shelter. And 2, that as a result offers, a pathway to, exit homelessness. Because of that's the intent. I think we need to say something about the organizations that are doing the work. And then also about the goal of exiting homelessness that as part of the intent. I know it may be under the purpose, but does that make sense, Sadie, as intent?
You want to add a number 5?
We do.
Okay.
Yeah.
Okay. So, and I think I heard you say is you want some type of language that would allow for the flexibility within the continuum
To ensure
to ensure the community partners are given some type of flexibility and to create a pathway to homelessness. Is that what you're trying to say?
for participants, yes. I'm saying that.
Okay, but you are also wanting the flexibility to be for the benefit of community partners.
Yes,
Okay, I'll try to figure out how to say that.
that came through loud and clear yesterday.
Purpose, it is the purpose of this act to establish a continuum of supports and services for households who are experiencing homelessness or who are at risk of experiencing homelessness, to ensure that tailored temporary emergency housing assistance is available to Vermonters in a manner that encourages efficient and accountable use of taxpayer funds, that supports self-sufficiency and reduces returns to homelessness by developing personalized housing plans with required participation by households. Top of page 3, establish clear eligibility criteria and require active household participation. 5, expand the use of alternative emergency housing models in partnership with municipalities, nonprofit community-based providers, and private landlords. Integrate supportive services to assist households to achieve permanent housing stability. Establish transparent accountability measures, reporting requirements, and oversight mechanisms. Increase program efficiency and promote maximum flexibility in administering services and supports in the continuum. empower local communities to administer emergency housing services with maximum flexibility.
Yes.
And create diversified system of emergency housing options, including shelters, specialized shelters, shared housing arrangements, post-home models, master lease units, and rapid rehousing placements that provide cost-effective, sustainable, and supportive outcomes to households.
Okay. Definitions. Thank you.
Okay.
We're good with that, I think.
Okay.
That I don't know necessarily that we have to read through all of the definitions. I know there's one that the agency is concerned about, and it's probably something we will stop at some point.
Okay.
And I think it's right here in number 17.
The same. That's that.
So this one is disability, and I think what we have learned and we've used this term in the bill within this bill and within this program. It's not meant to be linked with SSI. It's not meant to be linked with the definition of disability used for Medicaid or other services. So I'm fine with this, and I think somewhere in the bill we should say as used in this chapter, this program, or this process. Does it go here or does it go later?
I'm not sure what the second half of that sentence.
Well, it's how do we say that disability for purposes of this
Bill.
bill
Yeah.
needs.
Uh-huh.
So we're excluding.
Others.
You don't have to say anything.
I don't, right?
Yeah.
You don't have to say it.
Nope, that's what you have right here as used in this chapter, so it only applies to this.
Oh, it's
bill.
already here. Okay, we're good. Fine. No, I see, we're not fine. Brendan, go ahead.
Sorry. Brendan Atwood, Agency of Human Services. So our concern with the definition here is this is used in the prioritization scheme. And the way we read this now is it's overly broad. It would actually make it difficult, if not possible, for us to meaningfully prioritize folks. Conditions including asthma, arthritis, hearing impairment would all qualify. And I think it would undermine the intent of this bill to address the most vulnerable folks. And so we would, given that there's a prioritization scheme here, which seems to reflect a desire to have certain folks put before other folks in this continuum, we think that this language essentially undoes that.
So I hear you, and I saw the memo on this, but it seems to me that anyone who works in this field as a case manager would have the capacity to understand triage and who should be first. I mean, someone who comes in with in a wheelchair and who can't take care of himself or herself, that person would receive priority over someone who might have be hard of hearing.
So Madam Chair, we would agree with that approach. We don't feel that the language clarifies that. And we feel that we would be in front of the Human Services Board asking why we move forward with that kind of prioritization scheme when others might feel that that was inappropriate prioritization. And
This
so
just says what the disability is. It doesn't say priority. I think the priority is later on in two places.
right.
One is with case management, and two, it's in the rulemaking process where prioritization is given to those who have the greatest number of problems. So
Any points well taken. I think we can look at that section and have some additional language there to strengthen, essentially just to guide how these
we'll
decisions
look
are going
at
to
it.
be made
Yeah, no,
around
we'll look at it.
prioritization.
I understand
Yeah.
exactly what you're saying, and we don't want to make it difficult for anyone who's doing the eligibility determinations. We don't want to do that at the same time, there's flexibility. And you've got a family and three of the kids have problems and none of them doesn't, and the parents are okay. How do you set that
Right.
priority?
And that's exactly right. We would seek
Yeah.
that guidance for how we would prioritize those populations within that framework.
We'll
So-
have to, we'll look at that as we go.
Thank you.
Appreciate that.
Yeah.
Okay. What? Chad.
Yes, Senator, thank you. For the record, Chad Simmons, Housing and Homelessness Alliance Vermont. We support the definition of disability as it currently stands in the bill. And I think it's important to recognize that we're also in support of, as you mentioned, the flexibility and trust that the providers will be able to do that.
Okay. Okay.
Thank you.
Good. Yeah, it's good to have you back.
Would you like me to read any more of the definitions or get over to the next section?
Where are we?
We are in the definitions. Do
Let's
you,
keep going. What page? Unless there's a place to stop. If anyone in here sees a reason to stop, as we scroll through, why don't you just read the headers for each of the definitions and so.
okay.
Someone might wanna.
Okay, so we have a definition for diversion, eligible household, emergency cold weather shelter, emergency housing, highly structured shelter, homeless, household, low barrier shelter, minor child, office, permanent supportive housing, prevention, program, rapid rehousing, shelter, specialized shelter, supportive services, unsheltered homelessness.
And that takes us to page,
And then
any. So it's all as phone difference. Hang on a sec. All right. It's nothing about this building. Okay.
And next you have the, you're establishing the continuum to create an array of services that prevent and address homelessness in Vermont. Program is to be administered by the department's OEO. The office shall maintain a continuum of services that is flexible, housing focused, and designed to prevent homelessness whenever possible. The continuum shall prioritize early intervention, rapid resolution of housing crises, and equitable access to emergency and permanent housing. The program shall provide.
Why don't you take it up just about 1,000 feet?
I
so
would
that-
be happy to.
Yeah, and just scroll a little bit slowly and, just say what each section is. And because I think we've been through this and you don't need to read every word.
Great. So this has different elements that would be part of the program. Different goals of the program. And then you have this new language about that any funding opportunities under the program are open to anyone, even those that didn't previously receive funding. Then you have the program components. And if you remember, you move permanent supportive housing out of the levels. This talks about budgeting and presenting each level as its own line item in the budget. Maximizing federal receipts. And then top of page 11, the office or community partners shall offer to place a household in the appropriate level, subject to capacity, staffing, and geographic accessibility. Then you have the first level, which is prevention and diversion services. Second level is broken into two pieces. So first you have your highly structured shelter services that emphasize case management. You also have your low barrier shelter services. Both talk about that contracting piece for not less than 2 years. Level
That's
3
for the organizations that are running the shelter. We clarified that.
Yes. Next is level 3, specialized shelter services. Same contracting issue. Page 15, level 4, hotels and motels.
Who's pointing at you?
Alex is.
Oh, go ahead.
Hi, Madam Chair, Alex Grambles at the ACLU of Vermont.
Where are you?
I am looking at both of those sections, both the highly structured and the
What
specialized
page?
service shelters. So the first one would be on page 12.
Mhm.
And I'm looking at lines 9 through 14.
Mhm.
I just want to flag that our comments related to potentially mandated treatment within some of these levels is present in this section. It says that they shall provide programming that provides.
So the concern is that you're forcing people to participate and that you can't have people aren't going to willingly volunteer to participate in various services. So shall offer participation and I think the offering of is probably more appropriate. I agree with you on that.
Thank you. I appreciate that. And
Yeah.
where this really shows up, I think in the strongest place would be in household responsibilities. So maybe I'll raise my hand again during that section because that really dictates someone's eligibility for the entire continuum. So thank you.
Okay, we'll try to live with that. And I think it does make sense. Can't force people to
Thank you.
react to one thing.
So highly structured shelter services shall offer to provide programming.
Shall offer programming.
Shall offer programming. Okay.
And there's another place you were gonna recommend that.
Yes, and that was in the specialized service shelters section, which I am page 14. And it looks like it's lines 12 through 16. And I think the same language, ensuring that services are available but not required, would make sense there too. Thank you.
Well, shall offer service.
Got it. Okay. We made that change. Okay, so at the hotels and motels, we have some intent language. Department responsibilities if a hotel or motel is utilized. Page 16, subdivision 3. If a hotel or motel is utilized, the household responsibilities, participating in case management, planning for housing stability, etc. Subdivision 4 is which rules the hotel or motel has to comply with. Subdivision 5 is the capped rooms per night. So we have 700 outside of the cold weather period and 1,000 within it. And then we have language that the individuals who are obtaining hotel or motel services pursuant to section 602, which is the domestic violence and sexual violence population that's addressed in a separate section. That population doesn't count towards the number of capped rooms in that section.
Right.
Okay. We have your new section on permanent supportive housing, including new language that an eligible household can receive these services as long as their plan deems it necessary. You have a section on other emergency housing services, which is broken into 3 parts: municipal supports, emergency cold weather shelters, and alternative AHS housing solutions. Then you have household responsibilities.
We have a hand up. Go ahead, Amy.
Household response, Amy Johnson, Vermont Care Partners. Household responsibilities, subsection C or 3. The similar language around the mandated treatment is in the section as well, so
Okay.
that would need to shift for us.
It's offered an opportunity to engage with. Sorry. I think most people are gonna welcome that opportunity. I would think.
You're in A3.
Take line 15.
Yeah.
Yeah.
Line 17. Develop a housing plan. Yeah. That's what it's right. I don't think it's line 17.
So at 15.
I think it's not.
Where are you, Amy?
What page is that?
It's line, page 18. Page 19, line 18. No, 17.
17, where are you thinking?
Yeah.
Develop a housing plan and participate in employment, treatment, or other activities.
Engages to, how do we say it for reach out? I mean, if you're in a program and you're receiving services.
Just want to add.
Yeah.
May.
I have a
Pages.
suggestion.
Alex Crankles with the ACLU of Vermont. I think that what makes this section challenging is because this is eligibility for the entire continuum. And so if we could add, like, I would honestly recommend maybe ending the sentence at the housing plan instead and adding a new sentence using the word may. So that there's that element of choice preserved for individuals.
Oh, and may participate in treatment, employment, treatment, etc.
Yeah. Thank you.
I'm looking at Brendan. I'll look at you next.
I will reflect the conversations upstairs, in particular, highlighted really the importance of folks engaged in these program services as an effective way to achieve housing stability. And so we would still support that this be a requirement to participation.
So the question, what is the goal in number 3? What is happening in number 3 before I go to other things? And then let's just hold it for a second here.
So, we read this as a requirement that they engage in case management, that they develop a housing plan and they participate in the necessary services such as employment, treatment, or other activities. We don't feel it's appropriate in regards to opt out of those services. If they're going to be an important aspect of them achieving their sustainability.
Katie, can you help me here? I'm trying to find the page it's on.
Oh, page 19. Page 19, subdivision A3.
Lines up.
So we're looking at lines 15 through 19. And right now, this is a collection of items that are the household responsibility. The household is doing each of these items. And then you have this catch-all phrase in 18 and 19, unless explicitly exempt from case management requirements under this chapter of federal law, because not all of the programmatic pieces, like the low barrier shelters, require participation in case management. So the question is whether to put the word may in line 17 before the word participate, which would have the result of requiring that the household to engage with lead case management entity and to develop a housing plan, but it would only be a may on having to participate in employment, treatment, or other activities as appropriate.
So what I'm going to suggest in front of engages is agrees to engage. So all the others are agrees. I'm looking at number 2, 3, and number 2. So that makes if they don't agree to do it, then, end of conversation. Hold it. I see your hand. I see everybody's hand. I'm in the middle of thinking here. So agrees to engage. And then the question about it's agrees to engage in the planning process and participate in employment, treatment, or other activities as appropriate. So as appropriate is a modifier already that's there. So I don't know that the word may does anything more there. Katie, am I right or wrong on that?
May makes it optional.
Yeah.
If you leave it as is without the may, then there are going to be some households that can't, participate in employment and they wouldn't have to.
But as appropriate. So as appropriate would mean that the household might not be able to participate in employment.
Yes, and then they wouldn't have to. Because
And they
it would be
wouldn't have
appropriate for
to.
them.
So may is like belts and suspenders. I don't think we need it. Really don't.
This may be an area where, find consensus.
We're not gonna. Okay, Chad, Brenda was first.
I just wanted to say that I think that the individualized housing plan, if you leave it at that, then the individualized housing plan, where it's appropriate, is going to include whatever the participant is able to do. And it's going to be well done with the case manager. And I think that if you put shall participate in treatment, all of the data, I'm sure you've heard on opioid and everything else, that so says that that is not a way to force people in engagement. However, continued engagement with their case manager may lead to that. And if we cut that off because they won't immediately go to treatment, then we lose that opportunity and we have more homelessness.
Okay, Chad.
Chad Simmons again, HHAB, we would agree with that. I think there's two things to just state. There's the population of people actually being served, and then there's the agencies. As you heard yesterday, the providers shared very quickly or very succinctly that if you exit people from the program or don't allow them to be able to receive services, they're just going to cycle through. And so that puts more strain on providers and it puts more strain on the system, and it costs the state money. So if we're trying to be efficient, this isn't the way to do it. And I think, as Brenda said, the research shows that it's better that we.
Amy.
Amy Vermont, Amy Johnson, Vermont Care Partners. I agree. I also want to say this would be an unfunded mandate for community-based organizations. There's not additional funding. This would be additional people. We want to see people when they're ready. We are no reject as DAs, so we have to see everybody who comes in the door. So it would create bottleneck in the system, wait lists, while people who are willing and able to be part of treatment are waiting. We have people who are forced to be there. People should be seen when they're ready.
Okay, Alice.
I just want to say that Brenda's,
For the record.
oh, sorry, for the record, Alice Crambless, ACLU of Vermont, be supportive of Brenda's suggestion to just end it after a housing plan. Otherwise, we strongly feel that May would need to be included. Just to agree with what Chad was saying, the outcomes for people who are coerced into treatment for substance use disorder.
We get it.
Is small.
We're good. Okay, so
Just one last thing, and I to ask for the removal of lead agency. As you heard yesterday, the providers would prefer that it just be made for case management to happen.
understood.
Thank you.
I get it. Okay. We get it. All right. So this one is this one's a tough one. Engages with a lead case, agrees to engage with a lead case management entity, such as a Department of Aging or community development housing plan. So the suggestion has been made.
Oh, I know, I have.
It's not up there.
I have 1,000 emails coming in all at once that need to be answered. Sorry.
Do we need to take a break?
We will in a minute. We're gonna finish this and we're gonna take a break. Katie might need a break.
That's what I'm okay, but I just can't
We're gonna
share
finish
for
this little section.
5 more minutes, 3 more minutes.
So I'm gonna look at Brendan, if we put a period after plan.
You know, I think we still feel it's important, and I reflect up in House Human Services, this was important to a lot of the folks who voted for this as well, that there's an expectation that folks at least agree to engage in the services that are available to them.
So develop a housing plan
That's aspirational.
and participate in other activities as appropriate.
Exactly. We agree that as appropriate is leaves some wiggle room there, but it shouldn't be an option that folks can receive these benefits and choose to not engage in the necessary support service.
Oh, we just said that. We've got agrees to engage.
Yep.
And then what if it goes after plan, if we added and other activities as appropriate, then there's also the whole discussion that goes on. This is eligibility. Right, and there's things, the last part about explicitly exempt from case management requirements under state or federal under this chapter of federal law. That I think is important to leave in. You can take that out. But taking out employment, or we could say in other activities such as employment treatment as appropriate, something like that. You don't like that either.
We can work with that.
Fine. We'll talk about this. Committee, what are your thoughts here? End of conversation around the room, table conversation. I want decisions now on this one. This is important.
I think there needs to be something in here.
Okay.
I guess I'm hearing the agency say you need to give us flexibility. I think the argument I'm hearing is you're homeless because you have a substance abuse addiction. You might not be very pleasant to have in a shelter because of that. So do I have to agree to go into recovery in order? And do I have to be serious about going if I think that's what we're getting at? Or, you know, if you find me a job, can I say, I don't want to work? And have the state still be supplying you when this is a limited resource. But I think an awful lot of this is one-on-one, and it takes people time
to work it through.
And and that's what the people on the ground working with individuals do. So how do we find a system that allows that flexibility, but also has enough structure where you can't say, I'm happy the way I am, and I'm just not going to do anything, and the law says you have to take care of it.
We get that. We get the.
Okay, so
what
that's
the
what I'm trying
philosophical
to,
differences are here.
how you put that into words.
Right, so that's as appropriate. But,
Yeah. This is about engagement and accountability, right? And so the engaging with a case manager
agrees to engage with a lead case manager.
and beyond that, I feel, I get it, it's aspirational, but human beings, as we've said, are complicated and it doesn't always follow a straight line, so. It seems.
Would you put a period after plan, or would you say, and participation in other activities as appropriate, just leaving out the examples?
I would put a period after plan, but I know we're not, it sounds like we're not.
I mean, is the lead case manager the person that's in that shelter every night talking to people? Or is it somebody from the state that arrives once a week? But I think there was a description with a clipboard and says, and what number are you? I mean, we're trying to put into words what is it, a human interaction that has trust, which is the person that's there
Case manager.
every day.
Yeah.
When you have fallen off the wagon and you're at your worst, and then to say, attaboy, when
So you're raising a really good point. If you look at the language that's here, it says, if we say agrees to engage with a lead case management entity, such as AHS, a community partner. Okay, I'm gonna upset the apple cart with my.
I thought we were getting somewhere.
Yeah, I think, I'll go back. I'm just making a suggestion. Agrees to engage with a case manager, on-site case manager. If we said that offers some promise of, golly, Ned, you're gonna have somebody working with you, so.
And if they're not doing that, then.
It's hard. Oh my gosh, I see the right heads nodding together. I love this.
Okay, on to the next section.
Katie didn't hear it. I don't know if I can say it again.
You said agrees to engage with an on-site case manager.
Yes.
That's it. Striking the
Yes,
rest.
agrees to engage with to to develop a housing plan
Okay.
or other activities.
Just engage, just.
Oh,
leave
Gotta
it
be
there.
engaging.
all right.
That's
I mean,
the bare minimum.
everyone
You want to
is
put
going
the
to be
plan in
doing
there,
a
period, or
different
no
thing.
plan, period? To engage, and to engage, we're actually around the table now, so don't get excited. Agrees to engage with a on-site lead case manager,
Period.
to develop a housing plan, period.
I think that's important because
I do think that's important.
A housing
Yeah.
plan or a,
No, that's important, Senator. Just that.
But yeah, what's the plan?
Say it.
and we don't have housing, but other than that.
Yeah, the housing plan would be a shelter. What?
And then-
Uh-oh.
Lily Sojourner, Office of Economic Opportunity, just to note about maybe not the word on-site, maybe not necessarily. Because just a reminder that this applies, at least my understanding, to people who are at any point in the continuum and may therefore not be in a shelter. They may be at risk of homelessness and so just, I think is potentially an unnecessary qualifier and a qualifier that may not apply to
Okay.
situations.
That makes sense.
I'm seeing some agreement with that
So
one.
thank you.
Can you go through it again?
So let's. Okay, what do you have?
I
I know what I have.
Talking about it.
If
I
it's
have
the
engaged to
janitor,
engage with a lead case manager.
Wait, I can't hear Katie. Okay.
I'm sorry.
Yeah.
Agrees to engage with the lead case manager. I have that you are taking out such as Department of AHS or community partner.
Yeah.
To develop a housing plan, and I'm uncertain if you want the rest of that phrase in there.
I think we just put a period there. And then we also have to have the unless exempt, explicitly exempt with the language of that last phrase on lines 18 and 19, I think.
Since we're getting rid of a lot of the accountability, I'm just wondering if we should get rid of the word agrees to engage.
Mhm.
No? Okay.
No, this is eligibility, and you gotta have some way of ensuring that people are going to get the support. and help
Well,
that
that's
they
what I
need.
was gonna say, just engage with.
Yeah.
I have
With
a
a case manager.
question
Agrees.
on,
I want agrees in there because look at number 2. I'm just all over agrees.
I have a question on whether or not you want actual lead case manager, or do you want just case?
It's case manager. We don't need lead.
That's what she didn't read that, so that's why.
I didn't hear that. All right, I'm with you. Yeah, well, are we okay with that?
Yeah.
Yep.
Wow.
So I suggest a quarter after we're on break, don't try to advocate for anything.